Welcome to APD Oncology, Student and New Professional Subcommittee Diagnosis Downloads. Today we will be talking about colorectal cancer. Colorectal cancer is the third most diagnosed cancer in men and women in the United States. Typically, most colorectal cancers are diagnosed as adenocarcinomas. The other types such as carcinoid tumors, gastrointestinal stromal tumors, or sarcomas are possible. Some non-modifiable risk factors include history of inflammatory bowel disease, familial history of colorectal cancer, and inherited syndromes. Some modifiable risk factors include obesity, sedentary lifestyle, smoking, heavy alcohol use, or high consumption of red meats or processed foods. Common signs and symptoms of colorectal cancers include change in bowel habits, whether it's frequency and or consistency, abdominal pain, bloody stool, black tarry stool, or bright red blood around the rectum, and with advanced disease may experience jaundice, hepatomegaly, adenopathy, or bowel obstructions. With colorectal cancer, individuals may experience a reduction in physical activity, whether it's due to the cancer itself, surgery, or related treatments due to fatigue, pain, malnutrition, or related other effects such as neuropathy in the feet or hands due to treatments. This has a significant impact because this reduction in physical activity can lead to loss of muscle mass, loss of muscle strength, and loss of endurance, which then becomes a cyclical effect where the individual doesn't want to participate in as much activity and they continually get weaker and lose cardiorespiratory fitness to the point where they become dependent with all activity, which has a negative impact on their quality of life. There are also, with surgery, potential scar adhesions and myofascial restrictions in the abdomen, which can affect posture, which can affect pain, their ability to move, which can lead to reductions in physical activity, and then further increased dependence with ADLs and IADLs, and lead to a poor quality of life as well. And also, depending on the location of the tumor and the surgery performed, they might have a temporary or permanent ileostomy or colostomy, which can affect, again, body mechanics, their ability to exercise effectively, again leading to reduction in strength and endurance and reduced independence and reduced quality of life.
Fortunately, physical therapists are in a position to play a role in reducing the risk of colorectal cancer in high-risk individuals through education and guidance on positive lifestyle modifications such as diet, reducing sedentary time, and smoking cessation. Physical therapists also play a role in the prehab, acute, and post-treatment settings for individuals with colorectal cancer through the development of an individualized exercise prescription to promote cardiorespiratory fitness and strengthening, as well as manual therapy for scar tissue and adhesions, and education and interventions for pelvic floor dysfunctions to promote the optimal quality of life and physical function for each individual.
Lastly, some takeaways on this diagnosis downloads about colorectal cancer. Exercise can play a role in the prevention and risk reduction of colorectal cancer. Appropriate aerobic and resistance training prior to and following surgery is beneficial in promoting recovery, improving physical function, improving quality of life, and improving cancer-specific endpoints. Following surgery and adjuvant treatment, there may be scar tissue adhesions or myofascial restrictions, which leads to impairments in posture and or body mechanics, which can play a negative role in physical function and quality of life. Lastly, assessment of the patient's nutrition status and education on appropriate protein intake is important to promote skeletal muscle mass gains. Thanks for tuning in, and look for more diagnosis downloads in the future.